So let me call this meeting of the Gloucester Board of Health to order. It is Thursday, January 9th. It is roughly 5:40. And we are in the Harbor Masters Conference Room, and this is a hybrid meeting. The public is welcome to attend this meeting in person, but you can also Zoom link to the meeting. Though please note that the in-person meeting will not be suspended or terminated if technological problems interrupt the remote connection. So first order of business, we should go around the table and each of us introduce ourselves, starting with the director.
Oh, Dominique Curley, Director. Chelsea Goldstein-Walsh, Regional Prevention Director.
Joe Rosa, Chair of the Board.
Eric Kaplan, Vice Chair of the Board.
Marco Pelzilla, Board Member.
Thank you all. The next item on the agenda is public oral
Chairman,
communication.
Can I just check to make sure that Bobby can hear us? Is that all right?
Okay, sure.
Because Bobby's our scribe. Bobby, can you hear us all right? Do you have full audio?
Loud and clear.
Thank you, Bobby.
Thank you, Bobby.
Welcome.
Next item on the agenda is public oral communication. That's an opportunity for the public to address a non-agenda item for up to 3 minutes. Is there anyone?
No, there's nobody. There's somebody called GW who I think is Gabby White. And Gabby's not here tonight because she is not well.
Yeah.
So she's trying to stay home and rest and not spread
Good.
anything around.
Okay, seeing no one, we will move to the second item, which is approval of the December 12th Board of Health meeting minutes. Do I have a motion?
Move that we accept the minutes from.
Second.
Second.
Marco seconds. Any discussion, amendments, changes, edits? All in favor? Marco?
Marco, yes.
Eric, yes.
Joe Rosa, yes. The meeting minutes of December 12th are accepted as written. Secondly, we have the meeting minutes of the December 19th Septic Review Subcommittee meeting minutes.
I know Thor's not in the room, but Marco, you were in the room and did the notes. I think that's important to note. I know that the whole septic review subcommittee room has read them and offered comments back to Bobby, and you're looking at finished goods here, so if that's of help.
We have a 30-day temporary.
Yes, so you should mention that.
And the minutes on the 1 to.
Are we
second-
talking septic review subcommittee or?
No, this is still back in the board
Okay.
meeting. There's just one word missing on the second paragraph. The third line
On
from the
page
bottom.
5, right?
Yes,
Or
page
page, yeah, page 5.
We'll issue a 30, should say 30-day temporary. It just says 30.
There's a
temporary.
date, there's a
A date
word
missing.
missing.
Okay,
That's the only thing I found.
does the fact that it say 30-day imply temporary, or do you want us to update them?
Issue a day temporary permit.
I think it was 30-day temporary.
We talked
Yeah, Eric, I see 30-day temporary permit too, unless you're looking at prior,
later. Later it says 30-day temporary, but that one is just.
in terms of what was
Second-
moved.
the Second temporary, 13. Here's one. Just says 30 temporary, so 30-day.
I see. Got it.
Oh,
We can-
okay.
we can amend
That's
that,
what you're
sure.
saying now, but temporary not missing.
Yeah. Devil is in the headlines. All right, we'll have that updated. So can we, can I recommend that we?
Yes, so retrospectively, we have amended the meeting minutes of December 12th board meeting to include the correction to which I believe is
December 12th.
That means.
it's the December 12th meeting, but the second page, agenda item 2, and the second paragraph, roughly 2/3 of the way down that paragraph, the health department will issue a 30-day, the word day is missing, temporary permit. I move that we make that edit.
So
Eric seconds, Marco,
Oh, yes.
Yes.
Joe Rosa, yes. Returning to the December 9th, subcommittee meeting minutes. Yeah.
So you have two of the three board members in the room. So Thor isn't here, but I think, two of the three are in the room, so.
Quite extensive meeting minutes.
A lot going on in SRSC. It starts on page, have you been able to find them?
Yeah.
Okay.
That's page 9, right?
Yeah, it starts on page 9, that's correct.
I just want to clarify, I think Joe, you said December 9th, it was the 19th.
Where does it say December 9th?
You said,
You had mentioned 9th, I just want to clarify, it was the 19th. December
Secretary
19th.
use system, yeah, it was 97.
Page 9.
no, he's not calling out an error. He's just saying you said it was December. Yeah,
Oh,
you said-
excuse me.
yeah,
Yes, December 19th, for
exactly.
sure. Yes. Are there any adjustments to the minutes? Yes.
I did.
I recall.
I'm happy in my part of the meeting to, in like my recap, to give you an update on what went down. If you'd
Okay,
like.
good. But the meeting minutes as written,
I move we accept the minutes.
all right.
I will second that.
Marco, do you approve?
I approve, Marco, yes.
Eric, yes.
Joe Rosa, yes. Next item on the agenda is the health director's recap of where things are.
Okay, so I have a few things I wanted to catch you up on. The first is that any day we will be hearing from the DEP on Condelin Road, which is the construction and debris transfer station that's being proposed to take place at 24 Condelin Road. We have in the past gone through all of the protocols that we have to follow, but I'm just going to give you a quick update. We've gotten back from Weston and Sampson, and I sent out to you tonight the review of Weston and Sampson's of the new application. So if you remember, they sent in an application. The Weston and Sampson gave us a review. They then sort of withdrew for a while, changed things, submitted that to DEP, which is what DEP is currently evaluating. And now we have in our hands Weston and Sampson's review of that revision, right? So if you remember last time we met with Weston and Sampson, they walked us through it. And if we need that again, we're happy to do it. So I'm asking if you all could give it a read and see if you understand, given the bigger meeting before, if you're confident in what they're recommending. And if you do want that meeting, we're happy to make that happen, right? So, because it's a good focus time for us to
There's no
reorient
money
ourselves.
constraint on making that happen, and does it?
There is money constraint because we're burning dollars against a fixed price, so we have to be very cognizant of
Okay, good.
what we do, and we can work with Weston and Sampson to see if if anything we can do to be efficient, like maybe submit questions up front to them so that they can be, less about the full review of everything and more about the questions we have specifically.
Right.
So just, I guess if you all could let me know if you want some help. What happens next when we do hear from DEP again at any moment is what we're expecting. We would then hire a hearing officer. And that hearing officer was already approved by you all last year, Art Krieger. And that hearing officer will come in and help us facilitate all that we have to do. I mean, I'll still be facilitating the logistics of it all, but the hearing officer will be our guide in ensuring that we have a compliant process that we're following. And the health department's role is to look at what the DEP approved, look at any conditions that are local and important to be, that might affect the change in decision about site suitability. And as soon as we hear back from the DEP, we have a chance to digest the Weston and Sampson, we can pull together and circulate those questions as needed. I want to remind you that if you have time as you're reading the review of the Weston and Sampson proposal, the November think the 16th, right? The 16th meeting minutes from last year. It was a separate meeting, and I
Sounds
can
right,
send them
yeah.
out to you. It's a really great reminder of all that all that we talked about. So the meeting minutes, Bobby did a fantastic job of saying, here's what, here's what the question was, here's what Weston Sampson's guidance was. And then if there were any board comments, they're in there as well. And we all did, if you remember, being very sort of religious about not passing judgment, but only asking clarifying questions. So that might be a good refresher for you to remember what was a concern, because it was a year ago. And if you can send me any questions that you have, either about process or the piece itself, I can assemble a master list so that we have a working document that we can share. Make sense? And again, anything else you all need, let me know, because I want to make sure you're effective in this. I don't really have a role except to make sure you're effective in this. So that's Condolen Road. So we are also working I think I sent around a note, and you all know about the accessory dwelling unit. Tomorrow's the last day to submit public comment on the same. Our council feels that we are probably covered, that the local regulations would stand, but doesn't think it's necessarily a bad thing that we all write in and make clear that we also want the local regulations referenced. And the significance of that is that the state is going to be publishing accessory dwelling unit legislation, and we are not allowed to have any of our ordinances or laws basically hold an accessory dwelling unit to a higher standard than we would a single family dwelling. And then there's other things that have traditionally been restrictions connected to ADUs that they're removing. Things like parking and all that, they don't really impact us. What does impact us is they talk about the fact that, we're not allowed to treat an ADU any differently than anybody else we would as it relates to Title V law, but they don't reference our septic regulations, which of course are pretty important in our ability to be able to, manage what's going on in our little corner of the world here. So.
Yes, so if I can just interrupt, that's important because accessory dwellings will almost by definition increase the flow of wastewater. And so that impinges on whether or not their septic system is capable of dealing with that. So that's important.
Right, and our local regulations, our buffer zones, the protection of our resources, the dynamics that we have are all in addition to what Title V requires, right? So several other towns have also written letters. I think our chairman wrote a letter, right? I wrote one, and if you are so interested, I encourage you to do so as well. The more support, the better. Any questions beyond that? No? Great. I wanted to also catch you up on Bond Street. If you remember, we had the situation with the transfer station where they were complying, but they needed to do a lot of work. I wanted to let you all know that they are fully compliant at this time, that 30-day window. They hit their deadline. We have a fantastic document right now. Gabby and Cody are both very satisfied with it. Proof of insurance is in place. The thing that we're working with them on right now, and it might already have been resolved, is that we don't yet see proof of purchase of the liners that are very important for this to be successful. And I know Gabby has been reaching out to them to be sure that that she has proof that this is in play, that these are happening, not just that there's proof that that's going to unfold. I also wanted to catch you up. I'm gonna jump away from the regulatory reporting side of things and catch you up on some work we're doing as it relates to compliance. So you have this visual in front of you. Chelsea, I can share with you. What you're looking at is sort of the eastern side of our island here. And you can see Rocky Neck on the bottom of the page sticking out just as a point of reference. From doing some wastewater testing, groundwater testing, we've found presence of human DNA in these waters. And what you're looking at in orange are all the septic systems that are out there. If you can see the yellow lines, those are all pressure mains, which means public sewer is there. And we have some private road dynamics that are going on in there. I think we have a total of, I've asked Connor to put the number in here. I think it's like 190 homes that are not compliant to pump out protocols. So this is not uncommon across the city, by the way. But this is an area that we really want to focus on. And what I'm going to describe to you next is the path that we're going to take in general to help improve our city's compliance. And at the end of this, I'm going to have an ask that we would have hearings for those that we can't work well with. So what we are creating right now, and I'll circulate them as we go, is a letter educating all of these homeowners on the importance of the septic system, the role it plays as part of our groundwater ecosystem, and the importance of maintaining the septic systems well. We're then going to move on to help them understand that they're not compliant to the what has to happen to be sure that they're managing their system well, which is required by law, and then are asking them to reach out to us with a date for inspection. And one of our open questions is, do we require a Title V inspection, or do we just require a pump out inspection? We believe that we should require Title V, which is by our right, because they haven't been compliant for so many years. And we really need to find out which systems specifically are breaching. Something is breaching, and we really want to have a full look.
Can I interrupt?
Of course.
Back to your beginning of your comments. Interpret the colors of
Sure. So green is public lands, I believe,
Yes.
right? Or wetlands, maybe. I have to, where's my eyeglasses here?
Freshwater forested shrub wetland.
Yeah,
is a
so the dark green is wetlands. The orange are the septic systems, properties that have septic systems, right?
Pretty impressive, isn't it?
And then the sewer, the little green circles that kind of run along the edge of Niles Beach, et cetera, you can see where the public sewer is.
Yeah.
But then you can also see, if you go here, right from here, you can see that the public sewer actually goes up into these neighborhoods and has pressure mains available as
Right.
well, which creates some complexity to connecting. But we are also working with Bill Gillis, who is very familiar with all of the capabilities here, and what it would take to
But
connect.
are not failed systems, but systems that haven't been pumped out or reported to have been pumped out
That's correct.
denoted on here somehow.
They are the ones that are, no, so they're not called out specifically at this level of scale. I can tell you exactly where they are. They're most of them. I mean, so we have such low compliance in the city, just to be clear. I forget the number, but when we did a whole city look at compliance, I think maybe 15% of homes that own septic systems are compliant to their pump out.
So who's responsible for reporting to the department? The pump out person or the homeowner?
The homeowners are accountable to get the pump out inspection happening, and the pump out inspector has to send to us the fact that it has pumped out. And in the case of IA, they also have a requirement in most cases that they have to say, let us know when a contract has expired as well, which we're firming up in our next rev of regulations. So you have both IA and traditional systems in here, and none, and the, extremely low compliance to them. And I wish, Gabby, do you want, I'm gonna just go over to attendees for 1 second and see if Gabby, oh, Connor's on the line, yay. Connor, I'm gonna make you a panelist. Because Connor's the one who's doing all this work.
Dominique, is it page 14? Are these the graphs that correspond with the rates you're referencing around compliance?
Connor, can you come off mute for a minute?
Hey, can you hear me?
Yep, get a little closer to your mic, please. So the question from the board was, is there any way for them to determine on this graphic which properties are non-compliant?
So not on that graphic, but on the Board of Health packet tonight, I do have a graphic inside of it that has compliant versus non-compliant in that area. It is on page, let me check that, 15 for you.
14.
15. 15 of the Board of Health packet has the compliance versus non-compliant rate.
Wow, that's something different when we get to it. So, yeah, so I was a little aggressive there. So 34% of people are compliant, and 60% are not. But what about this particular graph chart that we're looking at here, or this map, Connor? Can you distinguish on this map which of the properties that are non-compliant?
I do not have that graphic
Okay.
of what properties in particular are compliant versus non-compliant on that map. That is a general rate of the 168 properties that are over there.
So there are 168 properties that are not compliant?
There's 168 properties total. Of those properties, 57 of them are compliant due to having up-to-date records, and 108 of them are out of compliance either due to a lack of records or a failed Title V.
Oh, historic failed Title V. So 108 total properties. Make sense?
And they're basically just randomly distributed.
That's
There's
correct, but
nothing
we
that-
can't figure out
Correct.
what's happening in the water, so we have to kind of go out to them at large, and we want to do this across the city anyways, you know. There's an obligation to stay compliant, to pump out
Sure.
and testing as required. And so that's a, you know, big part of Connor's role, and I just want to, you know, call out to Connor for a minute. He's doing a fantastic job of getting up to speed and isolating out these homes and connecting with all of the people that are impacted in us being able to communicate to these homes and getting a plan in place. So that plan is to send a letter out, as I said, explaining the dynamics of what's happening, asking them to schedule, which I need your guidance on, inspection or Title V. And again, I think our recommendation is that we request a Title V. And then going from there to tell them that by 2 weeks from this date, you need to tell us what date that has been scheduled by, right? That's the
So-
first letter.
So I would be very interested, we have a septic system,
Oh.
personally speaking, which we pump out every year.
Of course,
Even though
yeah.
we're supposed to do it every X years, I don't know
Right.
what it is. I would be interested to know whether or not it's been reported as pumped out.
Yeah, you'll have to give us your address and we can tell you, because that was
Okay.
our intern.
Because
Last
I
year did all
wonder
that
how
work.
many of those are like that, where the reporting is at fault rather than the actual.
Yeah, could be. So let me tell you what we did around that. So we had, prior to last summer, we had no understanding of who was compliant or not. We had a big old stack of reports that these people were sending us and no people to work on it. This summer, we had an intern come in and take all reports that we had and put them in a database. We then compared to all homes and checked files to see whether was there any record of them. We found one supplier who had been doing pump outs and hadn't reported them and got all those reports in. We are now 100% up to date with all the records we have of any system inspection that's ever been sent. And we're pretty confident that all suppliers are now sending them to us,
Yeah,
right? So
good.
we have full record of
Good.
that. But could there be missing? There, of course, can be, yeah. But this is a great start in that we at least have the perspective
Yes.
of any data we have is in there. And we've also worked with the DPW on all of their records as well, because they get pump out reports as well.
So we've talked about this before. How many systems do we have actually?
Three,
Septic
three,
systems and
uh,
sewer connections.
what is it, 3,900? What's our
Yeah,
total?
it's thousands.
Yeah, it's like 30, we thought it was
Because at one point
3,000,
it
but
was
it's almost 4,000.
3,500 and then it was less and now it's more.
It's more. Yeah.
That's really
And
impressive.
again, we're gonna find out, we ask in this letter, you know, if you've connected to sewer, let us know, right? The way that we know if you've connected to sewer or not is through MapVO, which has all of the known connections. There's gaps and updates to this, right? Bill Gillis is pretty diligent about maintaining this. So I would be surprised if there was missing, but there could be, just from a timing standpoint. So first letter is let us know if you're connected to sewer. Let us know what date you're gonna have inspected by. If not, if we don't hear from them in 2 weeks, they're getting a second letter. This letter is a little more directive, right? Here's the law, here's the requirement, you must buy, which is more traditional for inspectional services. But we're gonna try the don't you care method first, because we think, you know, we are all one community and we really want to, you know, in our messaging to our community, be very supportive of whatever they can do. And then the third strike is when they don't respond to that with a date. That's when we want to call them before the board and have the board give the direction of what they must do. And so that's going to would be coming up in regularly scheduled board meetings, and perhaps, you know, we have a quorum also in SRSC. So every 2 weeks we could start to just, you know, have these homeowners brought up. And I think during that session, we educate them again and we really help them understand. An important part of this also is that we are going to be offering services to help. So there's septic loan programs, and Connor is meeting on those right now. And you know, figuring out the process for them. The health department's going to take a stronger role working with the treasurer's office to understand what funds are available and how they can be deployed. We're also doing research into anything else that might be available to help a homeowner get compliant. So we don't want to have people spending for no reason, but we definitely want to solve these problems. And in this case, we know we have something leaking significantly enough to measure. And you know, it feeds everywhere. It feeds all of our water. There's wells, and then of course there's beach waters as well. So we want to take care of that. So any questions on that, Connor? Did I forget anything?
No, you covered it. That I have a list going of properties that look likely able to connect to sewer, but I'll include that in the next. I'll include a graphic of that in the next. Actually, I think no, I have the graphic right down below of sewer connection available of non-compliant properties. So this is specifically for properties
This is
that are
up-
non-compliant.
Yeah.
And if those non-compliant sewers, if those non-compliant properties, it appears that they would have a sewer lateral available to them.
So what he's saying is 35 of the total 108 have the opportunity to connect to public sewer. And of course, that's your right to call. You know, you have the ability as the Board of Health to say you must in our legislation and the state legislation. And then you have 64% of them don't have an opportunity to connect to public sewer. So that means that we're going to have to do upgrade and repair. And then the possibilities are, there might be private roads, there might be, you know, availability, but is that correct? Kind of the possibilities are the private roads?
Possibly is where it's, you know, a certain distance away from a sewer lateral and kind of be contingent on if they have the funds to do it. It isn't as simple as just right across the street.
There may also be some proportion of those who have the opportunity to connect to sewer, but have not because they are summer residents or part-time residents or whatever, which also may complicate getting in contact with them. So.
Right, so we have their property addresses, that was part of the work we did last year as well. And we'll give you regular updates on how we're doing.
Good.
We're gonna learn from this, we're gonna see how effective we are, how we can best communicate to the homeowners, because clearly there aren't this many people that have disregard for what they have to do as by law, right? It's like probably a lack of understanding. And so we're gonna start by helping people really understand what's required.
Good.
And Joe, give us your address and we'll look you up and let you know what we can tell you about yourself. Actually, if any.
No, I know we're compliant. It's a question of whether or not it's been reported.
Yeah.
The homeowner never learns that, oh, we sent this in to the health department.
That's right. The homeowner doesn't really have an obligation for traditional, but for IA ones, they do, of course.
Yeah,
Because that goes on their deed. They have to sign a letter that says they know it. And again, we're working on that in our regulations to make it even clearer. So I wanted to give you an update on that. I also wanted to let you know that we just done reporting today for opioid dollar allocation, and we'll hear about whether or not we get the grant from the state. I think Chelsea did talk to us a little bit more about that.
Yeah.
In her section, but that was also taking significant time for us. And yeah, we just continue to operationalize and organize. We're focusing really hard on the inspectional side of how we can work more efficiently. Delegation is a favorite word right now. People feel good about delegating rather than trying to do it all themselves, like really figuring out functionally how we work better. And we're seeing great progress, you know. Any questions on the inspector's update or the health director's update?
Were you going to speak about the food inspection, or was Gabby gonna do that?
I'm gonna talk to you about well, Gabby's ill, so unless Gabby wants to come online, I know she doesn't though, because I talked with her just before this, so I'm gonna cover all of that.
All right.
So if we want to go into regulatory reporting now, we can just go through page by page really quickly. So So on the housing side of things, as you know, we are working on on the review of how to build the best compliance between landlord and tenant. Both have a set of laws that they need to follow. We talked about that in our last meeting. We're proceeding with the process for that, meeting with stakeholders, figuring out how it gets done. Ultimately, that will go before the before the city council, because it's a change in fee structure. And we hope our change in fee structures will be before the city council in February, by the way. I wanted to give you an update on Young's Road, starting at housing here and on page 12. And Young's Road, well, if you remember, 1 and 4 had pretty egregious debris around and a lot of hoarding going on. It's been a very long time to try and manage this. The court this week, I think Monday, decided to sign receivership. So that means that Mr. Young will now have a court appointed support system to help him take care of those properties and make them safe and compliant to zoning and not a threat to health and safety of the folks around. So that's what's happening in housing. We are, continuing on with managing through complaints. And, obviously during the cold here, just so you're aware, we have, people are having moments of a lot of heat appearing to be out. It's actually just being very cold. And so Bree is doing a great job of following up with all of them and making sure that anybody that needs help is getting it. And we've worked across our community organizations. Action Inc. and Grace Center are working day-night partnering for anybody that needs shelter. Open Doors standing ready to provide that same support, as is the Rose Baker Senior Center. You don't have to be a member. If you're cold, come in. And then also the library at 20 Main Street is also offering sheltering.
So who's communicating to the people without heat that these options are?
So we are, and also all of the folks that I've just described, those community
Okay,
organizations are.
Great.
We're in touch with all of the housing authorities to make sure that that's known. The mayor's office is publishing things, and I think we're putting out some press about it as well. So unfortunately, not a lot of people take folks up on it. Like I know that Action Inc. and Grace Center do a lot because they are actively working with those who are choosing to not be in homes or don't have homes and working with them, at a one-on-one level to make sure that if they want shelter, there's shelter for them. And if Erin was here, I'm sure she could offer a lot of, commentary on that. But I know she's traveling. So any other questions on housing? Okay. Sanitarian report, the numbers here, they're big because everything is so, complicated in terms of how we are managing through from design to, approval and then on to construction. And of course, the work that Connor's doing. A couple things to know about November. There's over 11 submissions coming in. We're using our dollars to support those homeowners that need help at complex designs. And then we are also, of course, leveraging, as we did in our last SRSC meeting, our right to ask for third-party review at owner expense. And that was one of the issues that came up in that meeting, was a homeowner did not want to pay that amount of money. And we went through and helped explain it, and they approved, a limited spend at the homeowner's expense. And, I want to just comment on that. There is money in our budget. I think it's, I think $6,000 or $7,000 at this point to support this work that we are going to be outsourcing. That's our own funding. So it doesn't go very far. And so we're using it judiciously as we need it to be able to handle this volume of submissions that are coming in, making sure we can get through them in a timely manner. So it's staff augmentation at some level then, or it might be a complex plan. And we need, we want to be sure that the homeowner is supported if there's a cost issue. So the health department asks for third-party review in moments when it's very complex. And in those moments, as we said to the board, we really need the board's support to request it, because otherwise, we have a gap in being able to provide you with comprehensive information and evaluation. One Bond Street, I already gave you the update on that, and so we're gonna be moving to permit. And then we have the Niles Beach area as our kickoff for compliance, and again, I wanna come back to you on the question. Do you feel that we should request Title V, or do you feel that we should just request that they have an inspection, a traditional inspection done, compliant, depending upon their system?
For my own, speaking for myself, I would go with whatever you and Cody, whoever is responsible for this, whatever their recommendation is. You guys are the ones with the knowledge.
Yeah.
So,
We'll probably do it by year of, you know, system installed as well, so
right.
before and after a certain period of time.
Any other comment?
I'm just curious, if it's an older system, wouldn't it fail Title V?
Potentially, yeah. I mean, again, what do you mean by failure?
So
Because
let's
it's
say
not,
it's an older system that's not compliant with Title V, it would probably fail Title V. So if it's just a regular inspection for an older system that's not up to par with Title V, then I think if it's failed, it's failed, they have to comply, right?
it's a great point.
So they have to upgrade to Title V at that point.
Right, and so do we want them to
So
repair
if
and
it's
upgrade?
something
for
an
it?
older
Yeah.
system and it's failed, of course they have to fix it, right?
Yeah,
But
but
if you're
is it,
gonna hold them to a standard of Title V, they're gonna ultimately fail no matter what.
so,
I would imagine anyway, I mean, forgive me, I don't know everything about it.
You're saying
but-
it's simpler to just,
Right, so if someone has an older system that's not
right,
up to par with
Mhm.
Title V,
I
then
understand,
of course they're gonna fail if it's not a Title V inspection.
yeah,
But
to
if it's
the best
a
degree.
regular
possible.
inspection for an older system, if it failed, it's failed, and at that point, they have to be upgraded to Title V
Right.
compliance, right?
Right, and so the purpose of the Title V is not just to know that they failed Title V because their system is old, but you know, going a bit further than what an inspector might do. You know, so the inspector basically, you know, looks in the tank and, you know, is anything leaking in the water, in the field? But they're not gonna do the full gamut of like, where is the problem? And so that's sort of the dilemma that we have. Do we want to just, you know, isolate where the problems are and then request a Title V, or do we want to go right to Title V? And so you can fail a Title V, and then have to do an upgrade and repair. But we would hold you to the standard of, you know, how best you could do it, you know. But we wouldn't necessarily make you be compliant to Title V during your repair.
well,
Yeah,
I
to
think we
correct.
want to, if I understand Marco's concern, we want a balance between protection of the environment with burden to the homeowner. We don't want to unduly burden people to
Because if an
make
older
an
system,
extensive
if an older
upgrade.
system's still working,
Right,
right, great. I
So we're
mean,
gonna get false reads, you're saying?
Right,
Yeah,
so, but if you were to hold them to a standard of Title V on an older system that's working, and it doesn't comply with that, then ultimately they would fail Title V.
okay, let's take that back and we'll send a note out, and let you know what our thoughts are, but thank
I
you for
mean, in a
that.
perfect world, wish everybody was compliant with Title V.
Right.
Right, but it's just not, I just don't think that's practical for homeowners to do that. Especially if it's working still,
Yeah. And it's just a question of being able to find the source,
right?
to find.
And I agree, it'd
Yeah.
be great to find it, but I don't know how in-depth a regular inspection for an older system is as compared to Title V is, but you kind of want to be careful and not burden the homeowner with a system that technically would be working under inspection.
Yeah, thank you for that guidance, Marco. So we'll take that back and come back with a plan. And on that note, we'll have a plan for all of it. So we'll, you know, how will the hearings operate, what will be your things to do and ask them to do, and how do we proceed from there? Okay, anything, thank you for that guidance. I wanted to catch you up on another one, 30 Concord Street. There was pooling, ponding water. We tested it, it was human. We requested that they do a Title V. This is the fire station, across from the fire station in West Gloucester. And they came in and did a Title V and discovered that there was a field that a fifth of the, you know, the the effluent was going to, and then 4/5 via distribution boxes that were reconnecting were going to an illegal field on city land. So they're on that one. The homeowners that were not aware of it, they bought the property. The Title V interestingly passed, right? Because they were just looking at the existing field. They didn't know until this ponding thing happened when again, which is how's that, because the Title V is pretty comprehensive in terms of what you're looking at. But with this, when this inspection happened, there, we knew there was a problem, and so they had cameras and they snaked into the pipes and they discovered this whole other system that was completely illegally built and installed. And so the homeowners are all over repair here. They've already, I believe, hired a designer and are starting on the work to repair it. They're completely, unfortunately on their dime and not their fault.
Well, congratulations to them. That's.
Yeah, for doing the right
Yeah,
thing.
exactly.
Exactly. We were actually talking about how in our press, we are doing employee spotlights, we're doing community organization spotlights, and we'd like to think about doing constituent spotlights, because people that just do the right thing should be called out, and applauded for their work, because it also sets the example for others that may not either know or have the same behaviors.
Yeah, I think in doing, that's great that's happening. I think a lot of people think of septic systems as just, an administrative burden that the city imposes. I don't think most people recognize that it's a public health issue
Yeah.
when they fail or when they're doing the wrong thing.
Yeah. They're
So
also
it
renewing
might-
the water table though too. They're doing.
No,
important things,
exactly.
keeping the water
And
table
so maybe some level of effort, I'm not hopefully I'm not adding to your burden of work, but just putting it out there that maybe additional information to the public about the septic systems are not just this thing that the city imposes on you to
Why is it
be a
important?
pain in the ass. It's important.
Exactly.
So,
And here's why. Here's why
Yeah,
it's important,
exactly.
and giving them an understanding of that. And we're working on other things like how do we get that envelope opened? We had a little straw poll about how many people that get logo letters from the city, how many people open those, right? And so, let's acknowledge what's real and think about how we're gonna get them opened. Because we need people to read so that they can act, because we have an entire file set full of letters that have been written with zero action.
yeah.
So it's not that the health department in past years hadn't been trying to go after compliance. It's that nobody responded to it, nobody repaired.
Well, who knocks on their door when we finally get the third letter? That they haven't answered? What's the final?
Come to you
Yeah,
guys,
well,
and then you
who
all are
knocks-
gonna
who
order
knock-
them.
Yeah,
who knocks on the
maybe.
door?
I
Yeah.
mean, and it's a sort of death spiral, right? Because if nothing happens,
Yeah.
people learn that, well, I
Nothing
don't have to
happens.
do anything.
Yeah, right. Well, something, that's what I'm asking. What's the?
But what if they don't show up to a hearing?
Fines.
and they have to come
So,
here?
so that's what we're gonna be working with, our legal counsel on to understand what,
Can the
how we
police
can
knock
have the
on their
teeth.
door?
No.
It's interesting that
Very
other
good.
parts of the city have in our ordinance that the police can be the representative of that department and knock on the door and
Oh, they
demand
can't. Okay,
something.
that's so-
Not for the health department,
Oh.
because we sort of have a different reporting structure to the state. And so we have to figure out how we can have, we have the authority. It's written quite clearly in law that we have the authority to demand. It's a question of having the thought about how we were going to follow up to make sure that we follow. Ultimately, you would go to court, right? Ultimately, we would take the person to court, and our legal, our city solicitors, very prepared to follow up on these.
Oh, okay.
We just need to talk with them about the volume and the operations and the process so that we can be sure that we're doing things properly, so that by the time it lands on a desk, if we have even people ignoring the board, that we have the ability to go ahead and pursue. Make sense? And again, we're right sizing it. We're not gonna overcook it. We're gonna, I really like that point, Marco. Thank you. Not putting too much demand. So food, neurovirus, I think you'll see in the nurse's report as well, is going around. And I think Sophia put in her packet here, or she copied you on the letters, and it's also in her packet on page 19.
So has that been confirmed?
The norovirus?
Yeah.
It was not confirmed. It's highly suspected because of the pace of movement and how many folks were
Yeah.
getting it. So we opted to be, you know, vigilant and let our restaurants know their role in it. So, in this letter, we reach out to the restaurants, letting them know that, you know, they have gastrointestinal symptoms. It appears to be foodborne, reminding them to wash their hands. It's the best thing you can do. Sick people don't go to work. And then below, you'll see again, you know, it's important for two reasons that we got this letter out there, but also that you can see at the bottom of the letter, the offer that the health department is to helping them be compliant. So we'll come in and train you. We'll come in and give you signage, like tell us what you need and we'll help you. So that's a really important part of what we're doing on the food side to help our restaurants be successful.
Yeah, and hopefully restaurants have no doubt that this is happening, but nonetheless, let me iterate that hopefully the restaurants are enthusiastic about this effort. Because we don't want Gloucester to become the cruise ship version of, you know, norovirus outbreaks.
Yeah,
Because
exactly.
restaurants will hurt.
That's right. Absolutely.
And you can see on the second page, on page 18 here, we talk about the case summaries. Where we're like likely norovirus for 2 cases and then a third case of Campylobacter, how do you say it, Eric? Campylobacter. That also very similar symptoms. So in all 3 cases, we worked with the state epidemiologist and followed very specific processes that you'll see here, the National Environmental Assessment Reporting System, where we are, you know, required to take very specific steps to look into these restaurants, to look into the actions of the employees and hunt it down. And again, this letter was just sort of that extra step to, you know, reach out to everybody up front and let them know that, you know, let's try and slow this down right away. We did get, you know, because I was copied on the list. He can, he's a panelist, so if
Okay.
Cody wanted to talk, he could. I think he's just listening in on his
Okay.
panelist. Cody, do you have anything you want to say? No, I don't think so. I think he's just listening in on his own thing.
Yeah, I'm just listening in. So
Okay, thank you. So as I said, people were doing it appropriately or inappropriately. And the next step is that we're going to continue to provide guidance and education to ensure that the applicants understand what's required. And we can continue to streamline the work. We're pretty excited this month because this is the first time that Sophia's been able to delegate. And the reason that she can finally delegate, what does delegate mean? Delegate means that the inspector is spending time inspecting. And our administrative staff is doing the follow-up and a lot of the paperwork that is keeping them from being out there inspecting and working with the public. And so we've taken making sure that the inspectors are spending their time with their subject matter expertise and administratively we're helping them. And so Sophia, since she's joined, and how long has Sophia been here?
Less than a year, I think.
Less
Yeah,
than a year,
less than
but-
a year, maybe
Yeah.
like
Yeah.
8 months.
She
or so.
politely declined delegation for a number of months because she just really wanted to understand everything. And this was the first month that she's finally been able to hand over some letter writing and things like that. So what that means is that she knows how she wants to operate. She knows what has to happen and she's able to document it well enough to be able to hand it off to support to make it happen. So we're really happy and
Well
celebrating
done,
that today.
Sophia.
Yeah.
Very nice.
Okay, I don't know if my pace needs to get picked up here a lit. Let's see what else talked about food, septic, communicable disease. A couple of things, you know, you saw all of the reporting that Cindy sent out, and Cindy, by the way, is sending these out weekly. So I don't know if you're getting these weekly, but Cindy does send out a weekly disease report. The mayor gets it, the mayor's office gets it. It's the same thing, but it's really what is the weekly metrics. As it relates to communicable disease and substance use, Tuesday was the first testing for BioBot in our wastewater treatment. So they're fully contracted. They will be doing weekly testing for anything connected to respiratory disease. And then I think biweekly testing for substance use, drugs that are connected to substance use, and are giving us breakdowns on that, giving us access to EPIs. I will give you all access to those dashboards. You can go in and tool around. I don't have it ready for you tonight. I had hoped to do that, but it would take me too long to stop now and show you. But I'll send you links, and as soon as the data starts to roll in, we'll get you a briefing and a training so you can come in and look at that as much as you want. What's great about BioBot is that it's an early read. It's a good almost 3 weeks, almost a month before we see things manifest in the hospital. And so it's just really important for us, especially as we look at H5N1, which BioBot now is tracking and has a panel for. So we can also, if it hits here, and I believe it will, we can also turn that on at any point as well. So anything, so then if we just move on, I'm cruising through 22 here. All of the cases are handled. Cindy, that's a big part of Cindy's job, is the clinical response. The COVID numbers, again, I'm very excited about the wastewater numbers because they're going to be a lot better than the reportable numbers here. I don't think this is reflective of the actual volume that we have. There was one thing I wanted to, so H5N1 is showing up in influenza A. And I have some interesting reports I already got from BioBot that show, influenza A last year and influenza A this year. The number might have been on a scale of, let's say, 1 to 100. Influenza A at this time last year was, a very small, not like maybe in the 25s, and it's already spiked up here. So what is it? We know H5N1 is counted in those tallies for wastewater, and we're going to keep a really close eye on it. We had a DPH briefing last week. They are stressing that there's no need for concern, but reminder, unpasteurized milk, unpasteurized cheeses, it's in the eggs as well. And of course, we've had some pretty serious illnesses and deaths connected to it at this point. Are there any other questions on H5N1 or any of the other
No, I think
metrics on disease?
It's great that we're starting to get quantitative data on these things. This is good.
Yeah. And it's again, it's a hop away from human transmittable.
Mhm.
Coconut water recall, want to be sure everybody hears about that. The name of the product, let me just find it in here. Jarritos, Jarritos, Jarritos coconut water, 12 can cartons made by TIP distributors. They've had some pretty significant contamination. And
What, page 27?
I'm on page 27 at the very bottom.
Glad I don't drink coconut.
I just bought a big container of it, and I saw
Yeah,
This
the
brand?
recall.
This
No,
brand?
it's not.
Oh,
It's
okay.
a lot.
but I also
checked.
found dried coconut water that you can dilute out of Common Crow. It's wonderful. It's like I was very happy when I found that. I came dancing back into the office. Because it's always there. It's sitting in my desk drawer. So cat food, I think you guys probably heard this on the news. They've had instances where H5N1 has infected cat food. Basically the products that are refrigerated, and that's because that they're using likely you're using infected fowl. And whooping cough is on the rise as well. In the last page, on page 29. We're not necessarily seeing that on here.
Are people not getting their immunizations?
No, there's, in Marco, we were talking about that last time, there was a big decline in vaccinations.
This is what
I
happens.
can't pay people to do the vaccine.
Yeah.
Yeah, until I get whooping cough, then I'll bring it back.
But we're also seeing reduction in like vaccines that we know are really important in children, really on the decline as well. So hopefully there'll be some good education going on at the federal level so that we can have some support rather than further demise there. And now I'm gonna hand it over to Chelsea, who's gonna tell us about what she's accomplished in prevention.
Okay, so obviously on the prevention side of things, our team, which is myself, David Tucker, Dan Lieber, and Lacey Natty, have been working hard on the prevention of youth substance use and mental health disorders. Again, we really strive to tackle those problems from promoting positive behaviors and environments for kids. That's the main strategy that we really use. It's a promotion of and access to healthy opportunities for youth that will mitigate risk factors that could lead to things like substance use and mental health disorders. So a couple ways that we've been doing that is through our Gloucester Youth Leadership Council, both middle and high school, those two groups are overseen by David Tucker, as well as our regional North Shore youth leaders. So in December, our Gloucester Youth Leadership Council was busy being little elves. We had 8 members, 7 middle schoolers and a high schooler who really kind of played a mentoring role on that day. Volunteered their time on a Saturday to pick out gifts to donate to the YMCA and the Cape Ann Kids Holiday Program. So from the YMCA, they had tags on a tree that were specific asks for specific kids. So like boy age 8 wants joggers. And for the Cape Ann Holiday Program, it was generic gifts and toys that they felt like kids their age and younger would want. So we brought them to Marshall's. They had a shopping spree. We leveraged grant funds that our youth chose to use rather than to spend it on an enrichment activity for themselves. They wanted to spend it on donating gifts. CADA very generously donated a bus and a driver for the second time in a month. So they donated a bus and driver for the holiday parade earlier in December. And then again, for this volunteer opportunity, transported our youth from Marshall's to Pathways for Children to donate the gifts, and then back to the YMCA to donate those batches. So it was really great. It was a great day. The kids had a lot of fun, and one of them even said, I wish I could be there to see the kids'
Them open up.
faces when they received the gifts, because they really started to almost like develop some kind of connection to these kids, like trying to think about what they might like and what they wanted to pick out for them. So it was really nice, and really positive event.
Do you think CADA is getting sufficient recognition to somehow show up somewhere that CADA is?
We plan on, we're doing, as Dominique mentioned, we're doing weekly partner spotlights starting this year. So CADA is going to be one of our partner
Good.
spotlights.
Good.
We also highlighted them. David Tucker wrote a press release and it was picked up by the news, and we
Good.
called out CADA, and that we actually had the driver pose in the photo with us. So we really try to promote them as much as they can. That's why I bring them
Great.
up in this meeting as well. But if you have other ideas on how we can honor
No,
what they do
I
for
just think
us.
efforts, whatever efforts you can make,
We had the
will
kids
no doubt
actually,
be appreciated by and hopefully continue their continued support.
I hope so. We also, because of where our physical office is actually located on their
Sure.
floor, so we know all of the employees pretty well. We share snacks with them, we talk to them every day. We actually had our high school youth leaders meeting last night and the middle school meeting tonight, and we're having the kids sign thank you cards to CADA as well to give to them. So we really try to publicly honor them, and then also like personally. Because we really value their partnership. Again, just celebrating another win that David recently had. He wrote and won a $10,000 Youth for Youth mini grant through the Department of Public Health to support some of the efforts of our GYLC groups. So that grant is going to be used for a youth-led campaign on alcohol prevention, kind of a 2-part strategy. One, to educate youth using a positive community norms campaign around educating on like most kids actually are making healthy choices, and most kids, and when I say most, I mean like over 50% of kids are not using alcohol. So
Are you
such a
finding a
fantastic
decrease in
number.
alcohol and cannabis use?
we are, yeah, overall, both here in Gloucester and state and nationally, there has been a consistent decline. Even compared to 2022, decline in substance use rates, all across the board, alcohol, nicotine, and cannabis.
And the reason, do you think? I have my reasons why I think, but I'm wondering what you think.
I have thought, I think during COVID, I think a lot of it was an access issue. I think
Yes. Kids weren't together.
kids weren't together, they weren't at parties, they weren't socializing. I do know that the perception of harm of cannabis is the lowest out of all the substances asked about. So kids think that cannabis is the least harmful, and so I do hear, and I've heard anecdotally, and also just, I think data supports somewhat that it's possible that kids are using alcohol less, but using cannabis more. I think it's just less like exciting to use alcohol. Kids are like, but like cannabis, they might be using more. So alcohol is still the most used substance among youth, and I think adults as well. And so the high school group has chosen to focus on alcohol as their current kind of target. For the middle schoolers, they have identified vaping as an issue that they would like to focus on. So we actually kind of have so this ties nicely into another campaign that my colleague Dan has been working really hard on around cannabis use, and really the perception that it's not harmful and how that may impact people driving under the influence of cannabis. People thinking it's not harmful, so it's okay for me to drive while under the influence of cannabis, which is obviously that's not true. It can be really harmful. So
Not a good idea.
he spearheaded a cannabis impaired driving campaign, and we actually were in the paper. So this is the online version of the paper. The imprint version will be coming out next week. And I say paper, Gloucester Daily Times. We had 75 students send in entries, youth-led campaigns, to try to educate their peers about the risks of driving while under the influence of specifically of cannabis. And these are some of the winners. The top 3 are like 1, 2, 3, like first place, second place, third place. And then there's 3 in there that are a smattering of the runners up. We're really grateful to our partners at the high school. Rosa Goulart is one of the health teachers, and she offered extra credit to her students who chose to participate. So that really incentivized a lot of participation. We got a lot of participation, as well as Karen Hurst, who is the coordinator at the Gloucester Health Center, the Student Health Center run by Wakey. She had her Youth Advisory Council also participate. So we got a lot of great entries from both groups. And all of the 75 entries will be displayed at Gloucester High School. And we will have like a selection of entries, including the winners, displayed at City Hall, outside the mayor's office.
Share the wealth, Jen.
So
Pass them down.
you can find it on Gloucester Daily Times online. So
Yeah.
we're very proud of all of our entries. People worked really hard on them, and we're excited. We think it's important. It's just an important reminder for folks, both youth and adults, about just the risks of driving while under the influence of cannabis and other drugs.
And what was great was the different styles, like some people were in Canva and doing more elaborate ones, and others were very, some people are very good graphically, and, some people just had pencils, but really thanking the health teacher to really make this happen, and
She really did, yeah.
it's wonderful to see this group moving at the clip it is. It's, you guys are doing great work.
We also had a very democratic voting process. We had folks from other departments. We had CADA employees coming in, voting. Everybody got a certain number of votes, and we tallied the votes. So it was very democratic on how these winners were chosen. So we feel good. We had a diverse viewpoints chiming in. So we're really excited and hope you'll be able to see the entries at City Hall. And lastly, I guess 2 more things. Lacey, Natty, has been working very hard, not just on our prevention and early childhood grant, which focuses on the 9 to 11-year-old population. Kind of like really start early, like starting working with kids and parents early to build up those protective factors. She's also really been filling in gaps to support our opioid settlement work. She's been working with Danielle Larrabee on getting a live page up on the health department website that explains our opioid settlement funds, our process for determining how those funds will be spent, soliciting citizen impact or input on how those funds should be spent. So Lacey's been working really hard. She developed and disseminated the survey and aggregated those results and put them into a presentation that was shared with the mayor and that can be shared with community partners. She's, as Dominique mentioned, really was essential in helping with grant reporting requirements to the state on how fiscal year 24 funds were used.
Seems like a lifetime ago.
It's
We've done
crazy.
so much since then. We did a lot then, but we've done so much.
So
since
much.
then as
It was
well.
like hard to be like, well, this is like
Yeah.
as of June.
So is
And
the one of the grants you're talking about is the RISE grant,
Mhm.
right?
Where's,
And-
yes,
And so that's drug, what do you call it?
Treatment and recovery is what we're focusing on
And
there.
is it administered solely by the state, or is it the state, the conduit through which federal money is coming?
So this is money that's coming
That.
from the pharmaceutical companies via settlement for the work that they
Settlement
did
to the state?
to the
not-
state.
Yeah.
Yeah, well,
okay.
they might have been other states as well, but
The-
for our
the-
purposes.
But it's separate
Yeah,
to
yeah,
Massachusetts. Yeah,
That's
I
right.
think
So
that's the
960 million around there went to the state. 40% of that got deployed to the municipalities, which is the monies that we have and we were reporting on, as well as what we've done programmatically. And now this first one, this RISE grant, is an example of when they're releasing tranche of dollars to accomplish goals within their mix.
Right.
So what the state wants us to focus on is prevention, right? How are we helping people not get involved? Harm reduction. So if you're in the throes of this, how do we keep you as safe as possible and get you the care that you need? And then, when you're ready and you are heading through treatment and then in recovery, how to stay successful, right? So what we had to identify for this RISE grant is just like, we had to really narrow it down and we could only focus on treatment and recovery and then a narrow window of the things that the community wants within that. We focus on the top priorities, right? Access to reduction of cost of care. So copays, transportation, being able to get you into sober housing at a lower to no cost. So funding directly to people to help them be successful. Adding recovery coaches to Tito Swatch so that we can expand our reach. And then being able to build sober programming, right? So core peer recovery being a key resource there, where we are going to help them hire people who are with lived experience to develop programs to help create a vibrant, sober community. And so the community impact unit is playing a big role in this. The core work might also help the Rose Baker Senior Center, who's trying to look for programming around alternatives to pain meds, so we're trying to stretch it as far, but our goal is to learn like what's working. So we're sort of going to be deploying this and measuring and just failing fast, right? If it's not working, we're not going to just stick it out. We're going to, move it where it has to go. Yeah.
and so there's, as Dominique mentioned, I think of it as like two pots of money. There's the 40% of the state coffers that are just deployed to municipalities, like based on.
$100,000 a year in our case.
They calculate based on population size and impact. That's a guarantee. Then there's the additional 60% that they're doling out via a grant, a competitive grant process. So this RISE grant is an example of one of those competitive grants that we did apply for. And it's, we applied as a region with Ipswich and Rockport as well, allowing us to ask for the maximum amount of money. So if we were just applying as Gloucester itself, we could only ask for a $50,000 grant. But in applying as a region, we're able to apply for the max 150,000. So we're still waiting to hear probably in
Soon,
February.
yeah, beginning of February, I think that we find out, and then March, the dollars come. We're really hopeful. One of the interesting things here is in submitting our fiscal year 24 reporting, one of the questions that they ask us is, what did you uncover that you can't support with this money, right? And so we talked about the housing issues that we have, and, you know, these big existential things that are facing our community. And then the next thing they asked us was, you know, how would you might change the strategic allocation of these dollars? And so there we pushed for bigger money, multi-year, right? So, you know, $300,000, although it's wonderful to have that working together across 3 communities, it's a drop in the bucket to really build a scalable program. And so we were encouraging the state to, you know, we were petitioning them that we're ready to think big, right? We have a community organizations lined to think big. We have incredible sets of resources, professionals that are ready to act, but we can't be tactically funding and expect any kind of way to move the needle. So we really want them to consider big grants, you know, and help us understand like what it takes to be able to land that stuff. I don't know how effective that will be, but at least we
They
can-
asked.
They're wonderful people over there, though. They're really.
They're great.
Yeah.
Yeah, they're very, it's Care
Care deeply.
Massachusetts is the technical assistance provider to manage the opioid settlement funds for Massachusetts, and they are very responsive.
Yep.
Um,
I can hardly wait to see what work.
I know. And
Same.
seeing and also seeing the organizations come together to be like, okay, we do have to not ask for everything. We do have to hone it in, and we're gonna rally around this, and likewise the municipalities. So it's my first rodeo, right? Like of like getting municipalities organized and figuring out what we can do. So it's been great learning for me as well. I forgot one thing in my update. I want to be sure you guys know the septic regulations are so close to being ready for review. We are now at the place where we are organizing them to equal Title V layout. So a person can go and read Title V, and then we'll have a corresponding section that is where we are adding onto Title V. So the things will be directly linked to so exactly where we're going deeper. We think it's going to be easier to understand. And at least aligning in some way, in a better way, we hope, than the document that was organized before. We have a septic review subcommittee meeting next week, which we hope to bring it to the septic review subcommittee. We're not necessarily looking for the subcommittee to be 100% aligned on things. In fact, they're not. But we're gonna, you know, bring the best of breed forward, and then we can work through it during the public hearing process. And we want to do one, we're also gonna, you know, put our perspective past a legal review to make sure that there's nothing in there that we're talking about that's egregious, and we're gonna test drive it with our constituents. So we're gonna share it with more designers, more installers, and get that feedback, right? So a little bit more work. We're really close though, in being able to say, okay, now we're ready to bring this to the board for a hearing. And I'm gonna find out, because we haven't done a regulation change. I don't know if you all remember, but we haven't done them in a while. So gonna get the guidance from legal on how we have to proceed on that. Okay. And is that appropriate, by the way, for us to be a little misaligned and be able to work through it in the hearing?
Sure.
Okay. I mean, they're not big points, but there's a few moments.
Right.
I think the board members are aligned. So, okay.
Anything else?
No, not for me. But the SRSC has been working really hard. So just want to
Yeah.
publicly
it's been
thank them for all their work.
Many months of work.
Yep.
So I believe the only thing left on the agenda is concern for the board. Any comment?
Quick on that. I've heard. I don't know if it's true or not, but Dogtown, I've heard a few stories about camps up there with homeless people. Is that fact?
Well,
Is it
there's
rumor?
camps with homeless people all over the
Yeah.
city. Yeah.
I guess I would,
including.
I guess I
Including
would, I think you had mentioned earlier about the resources for like if people are cold or whatever, or whether or not they know about that.
Yeah.
Maybe try a wellness check up there because it's really cold.
Yeah, so thankfully, the folks at Grace Center, folks at Action, they know most of those people, One Stop. There's a lot of community organizations that are actively involved. I know the Community Impact Unit has supplies, the fire department has supplies, and so everybody's very focused on keeping people warm and helping them get warm. It's not gonna stop them living in the camps, but we are definitely, there's outreach every night to make sure that if folks want help, they can get it.
And I guess I wonder as well, like what kind of public health risk is that to have them up there? Especially if they're by a water source.
Yeah, so they're not sanctioned by us, right? We don't say, yes,
I
go
didn't know
stay
if it
there.
was like us that dealt with that or not. but
Yeah,
like-
no,
but
it's
if
a
public
difficult
health, then-
problem because my understanding, when those individuals are challenged about offering them a place to stay and whatever, they often, maybe it's different when it's freezing cold like it is now. But they often say, no, I don't
Yeah,
want
they
to
don't
go
want
to
to
the
go,
house.
right,
I want to stay here by myself.
That's for all over the country. It's not
Yeah,
just here.
exactly.
But I guess I would wonder too, is like, on a public health perspective,
The water supply.
like the water supplies,
Yeah,
like
yeah,
what's
no,
what's
it's,
going in there, cause they're, as far as
But-
I know,
but
not
then
far
they-
from it,
Yeah.
you know?
The question then becomes, so what do you want to do with those people?
It's a good question.
That's the problem.
That is the problem, yeah, exactly.
I mean, I know it's discussed across other city departments and there's a very close watch on that. You know, to understand the impact, but it is an issue. You know, if you'd like, we can circle back with some of the rest of the city leaders and help you understand sort of what the path is around there, but it's the tough part, Marco, is that there's not an easy answer to it because
I can't imagine.
and the numbers are
Yes,
growing, you know.
I heard this brought up on NPR a couple weeks ago, and they were interviewing someone, I think out in California, who works with unhoused populations, talking about all the different variables and when, you know, like, do you provide porta potties to folks living in the woods to mitigate the risk of water contamination? And, or do you try to relocate, you know, like, it's nationwide. So I'm not saying, oh, well,
I mean,
it's nationwide or
that
whatever.
strikes me as a reasonable offer to make to people. On the other hand, I can imagine lots of people in Gloucester saying, why are you encouraging people to live in the woods?
Mhm.
And also who pays for the porta potties and what labor is there to actually make those porta potties be emptied appropriately.
Yeah.
You know, there's not a lot of flex in the city budget. And there's gonna be less, you know, we're facing a tough year, so it's, you know, it's a really important challenge to address. I think the work that Action's doing is really important. They are ready to help people move in as they are. One stop,
They go
really
out,
important part
yeah.
of harm reduction, building the relationship, making sure that they're getting the support they need so that they can transition if they're so interested. But some of these folks just don't want to transition. They are doing what they want to do.
I will say, I know the community impact unit and One Stop both have supplies of tents, blankets, and I realize it's really cold out, so a tent in this weather, like. But they are able to provide like basic needs supplies, hygiene supplies for folks who have been offered space in the shelter, particularly on cold nights, who decline that offer to at least have some protection. I realize that's not a long-term solution, but One Stop and the community impact unit really do go out on foot. Have connections and relationships with many folks who are living in the woods and are able to offer supplies and resources. But again, I'm not, like, I haven't been out there, so
I
I
was
can't
just thinking the same thing, you know, it's like I haven't been out there, so I'm telling you sort of what I'm told and
say.
it makes me want to go out there, right, and see, you know, physically what is being faced and what's happening, and I'm gonna commit to doing that, because, you know, it's hard to figure out how to solve a problem if you're not really.
I'm sure like
Amazing.
One Stop or like Tito would be happy to, I think, and again, I'm speaking from talking with providers, so it's like second, third hand
Yeah.
knowledge. There's wonderful resources, Action, Wellspring, like I'll provide wonderful resources, but there's a certain level of autonomy that you have to release when you enter shelter. You know, folks, there's certain requirements around sobriety, there's certain requirements around like no pets allowed, and there's different reasons why someone might choose to really like hold on to their autonomy.
This would be a
As a
great thing, I'm sure
priority.
Erin would have a lot to.
I was gonna say, I
comment.
wish
She's
Erin were
like,
here, cause
You know, Action's leading the charge, and I think they're opening soon, right? They're having their grand opening, really shortly.
Yeah,
at the
I saw
house.
that, I wanna go.
Yeah, Action Inc. is, you know, they've changed their approach, their mantra being no wrong door. Meaning like wherever you come in, Action will be ready to triage and route you to what you need. From, you know, care navigation, housing, job training. And so Erin's leading a lot of that, the services set there, so I think we could, you know, tap Erin and get a perspective. But Marco, I don't want you to think I didn't hear you, which is like, it's
No.
bigger than how are those folks
No,
existing,
it's
it's more
for
like,
sure.
is there also a risk to water supply, like what is the,
Yeah.
What's
Public health
environmental
issue
too,
writ
like,
large.
it's not just public water supply, think about it,
Yeah,
it's like
no,
environmentally, like it's
absolutely.
public land, I mean, there's animals, there's, I mean, what are they leading up there?
Yeah.
Yeah,
Right, so
that's
I'm
fair.
just curious, I'm not saying kick them out or anything like that, cause you're not gonna make
I
them
get it.
leave necessarily, but. I mean,
No,
if
it's a
it does pose
difficult
if it does
problem.
pose a risk, of any type, that's what we're here for technically,
Exactly.
right? So there's gotta be some other resource, whether it's state driven or not, to help them maybe get out of there.
But you can't
Yeah.
force them.
Right, you know, I at least offer
That's
something
kind of
different,
the problem.
that's
Yeah, there's
not in
no-
the middle of the woods, that
Yeah.
that, you know, residents would have, again, I think about public water supply, because it's relatively close to that.
Yeah.
And then all the stuff that might be left, because they're not gonna take their stuff with them, I'm sure that's gonna, you know, they can only pack so
The
much.
diapers, we heard tales of diapers and things like that. I'm gonna go take a walk and personally get out there, but I think also, I think this is a great reason Aaron's on the board too, right?
Just
So
a
I think,
curious thought.
No, that's a really good point.
yeah, I mean, it's why, no, I don't want to offer opinion, but it's like, you know, we need housing answers and housing answers are important. You know, increasing the volume of housing is important if we want to have people not be
It
living in the
sounds like they
woods.
don't want housing now.
Well,
Well,
there's
it's-
mental health.
Yeah,
Yeah, I was
gaps
gonna say
as
the
well.
intersection
Like,
of
you
mental
know,
health, substance use,
They're all-
financial resources.
Yeah.
Like, I think that all of that comes into play. I'm not saying everybody who's unhoused has mental health and substance use issues, that's not the case. But there are instances of that, and I think there's definitely, I've heard that there's a lot of co-occurring disorders, that may prevent or provide barriers to accessing resources.
Yeah, I mean, living alone in the woods, or perhaps not alone, but with others like-minded people, gives them a sense of autonomy. That
Community.
they don't have if they're being told what to do by other people.
Mhm.
And I mean, we can argue about, you know, the validity of that, and whether that's smart, but nonetheless, that's their reality.
Right, and it is our job to also protect public health, right? And so,
For sure.
yeah.
And that's something we've talked about, and I'm like way stepping out of my lane here, but I'm just naming it, that there are other barriers in terms of folks who may qualify for public housing, but may not pass a core background check.
Yeah.
So there's like there's some barriers there as well, or landlords who don't want to accept Section 8 housing vouchers, or they're unwilling to accept someone who may have a mental health history or criminal record, and so as the health department, like there's some policy that we may be able to influence around housing policy, and others obviously not. But that's another thing we hear, is that some folks who might qualify for housing can't because of those barriers, because of their own history.
Yeah.
That makes it challenging. And again, Aaron George would really know.
Is
all
there
of
anything
those.
specific, Marco, you want us to kind of look into here? You know, as you,
No, just kind of to walk. kind of
okay.
try to figure out
I'm sure the
if
community
that's-
impact unit will go up,
Oh,
because
yeah,
they have
offered. I just
really,
haven't had the time and it's
I
just
am
like,
thinking mostly right now for their own personal well-being, because
yeah,
it's
of course.
freezing outside,
yeah.
but.
And we've been in touch with Action and
Yeah.
Grace Center, and they are very connected to that community and are actively go out and make sure that anybody who wants to come in. And literally, I had an email from Aaron and oh my gosh, what's his name? I'm sorry.
Frank at the
Yes,
Grace
thank
Center?
you, Frank, because it's Francis in his email, so I always get lost in Frank, but Frank and they work in coordinated effort, so like they know most of the population who needs the help, and again, One Stop is doing the same. As a CIU, like there's a whole lot of people that are watching out for folks, so that when they want help, if they want help, it's there for them. So the community's well, open-armed about that, it's just
Am I
difficult
right?
to get them to break it.
Am I right in saying that Action during like cold spells like this, the shelter? In the past, I've heard that there have been times where Action Inc. has allowed themselves to increase their capacity to allow people to sleep even in the lobby on really cold nights. I don't wanna
wouldn't speak
overspeak.
for Action. I do
Yeah.
know though that Action has more than just their physical structure. They have access to hotels,
Hmm.
and voucher programs and things like that. So if people need a place to stay for the night and they can't shelter them there, there's other places that they can help people find a spot for the night. The same goes for, you know, people in their homes if they are ousted because of, you know, they're in an apartment building and the heat goes out or something, you know. Action Inc. will like help those people figure out what has to happen. As does the health department, obviously. If it's a landlord issue, we're all over that. Bree was very busy today.
So I was like, are you going to help Board of Health meeting? She's like, I can't because I have to go take the temperature
That's right.
in a home. Yeah.
Right.
Yeah.
And state's involved too, like state state sponsored, like in this one case she has, she is a state sponsored caregiver basically for this person who has mental challenges, and called us and said like, there is no heat in this apartment. Which differs directly from what the apartment owner says. And we work with this person all the time. So Bree's like, all right, I'm just gonna get over there and check it out. Yeah, there's a lot of issues like that, Marco, that it's like, what what can we do? Like
Yeah, no
substance use
good- no
disorder
good
is like,
answer, right? But
Yeah.
mostly just safety, but then I guess I'm obligated to say, environmental and public health stuff.
yeah,
Yeah.
Some
No,
answers.
Well, my own bias on questions like this is to create a society where that is not a go-to point for people,
right,
where you wouldn't consider living in the woods by yourself.
right. And the comprehensive planning.
How you do that? Good question.
Right,
Yeah.
How much time do we have?
yeah.
Well, it's obviously very complicated, but
Yeah. No, it's a good question. I mean, like, there's a post on Gloucester things about it, I was like looking over the week or a couple days ago, like reading it, like asking those questions about like, what services are available to residents who don't have access to stable shelter, and like, that's really important.
because you can't just go out there and pluck them out.
No,
I mean, there was in
It's
past,
like the same
past,
problem with getting people to do their immunizations.
Yeah.
They don't want to do them.
I mean, I remember it was at Boston Medical Center and they, people just lined up.
methadone,
No,
yeah.
yeah. no,
Just
they
lined
can't,
up, but periodically they would force them out.
Yep.
I mean, I'm not saying do that, but
Yeah, they just did that like a month or two ago, and
yeah,
now
they
they're
do it
coming, I was
often.
just there again, they're just starting to come back.
This
But all they're
place
doing
is-
is shooting up somewhere else and dying
Yeah.
alone.
Mm.
Rather than having at least a place where we know if there's something that's, tough, there's people there, they
Right.
watch. It's difficult. It's a call for, safe places to use, right? And, controlled environments. So it's sort of anti how we think about it, but it's like, they're in the throes of a disease. These people are helpless to their disease. And, they're living on the streets, and it's like if somebody had a broken leg, we wouldn't want them to be living on the street. And if somebody, had lung cancer, we wouldn't want them to be, living on the street, but because they have substance use as a disease, we seem to be accepting of it, and we don't necessarily want to give them what they need to get healthy. But it's a tough one because they maybe not want to get healthy. They're just so deep in, so. And it's, people have free will. So, but this is a start on the substance use side of things and building a community of care and coordination. Right now we have a whole lot of people working really hard, but more fragmented than it possibly could be. And so how can we take dollars and sort of start to unify approaches, get better impact? Destigmatizing act, that's a huge one, right? They came up in our data. People are in this community afraid to ask for help.
That was the
because
second
everybody
most
knows their
called out.
business. Stigmatization of saying I have a problem is huge here, and big part of what we ask for is significant money to communicate and to try and drive a change in perception, right, of opioid use or substance use as of moral weakness versus an illness. So much to learn. So very excited also, one quick thing, on the communications front. What we're doing is building a unified campaign that says, every quarter we're gonna pick a theme. Within that, there's 3 months. Within that month, there's a theme. And then within the weeks in that month, we have 5 categories of content. We have employee shout outs, we have community organization shout outs. We have events that are relevant and thematic. We have education programs from our health inspectors. What's my last one?
like community awareness in
then,
terms
yeah.
of like health services.
Yeah, and then on health services. So what we're trying to do is build a cohesive plan, and we're gonna be migrating from and I'm so glad I thought this, we're gonna be migrating at the city's request. From having our own website to
Our own
being
Facebook page.
our own Facebook page, thank you, to being to posting through the city site, but branded health department. And the reason for that is that it's greater reach, City of Gloucester's greater reach than the health department. We're gonna be doing some transitional communications to try and drive people. We are still driving the content. Danielle is, doing all of that work to make sure the proper messaging is out there, of public health alerts, that's the other one. And then the idea is that we'll be more calculated about our communication plan and just be rolling with it. DPW is also no longer having their own social media page. It's gonna go through the city. So yeah, and Pam Tubby's been terrific in sort of building that protocol, and Danielle will be working directly with her. So we'll watch and see how that goes. I'm sure there'll be some hiccups, but we'll keep you posted on that.
This month is Poverty in America Awareness Month, so a lot of the content is focused around resources that like social determinants of health, spotlighting Bree, spotlighting the open door, things like that, so.
And so again, what we're trying to do is just like figure out how to make our message stick and have a way. It's very hard to do. Limited dollars.
On that note, anything further? Motion to adjourn the meeting.
Second.
All in favor?
Thank you.
Yes.
Yes.
Thanks for your attention.
Did you guys get a chance to look? Do you want?
Thank you all.
That was cool.